Conway Medical Center and WPDE News Channel 15 present Your Health, Your Decision.
The ACL, or what's known as the anterior cruciate ligament, is a ligament inside the knee which provides the main stability to the knee joint itself. What it does is actually will provide support when you're trying to cut or pivot or even move side to side. I see a lot of patients with ACL tears, unfortunately, because it's the most commonly torn ligament inside of the knee. Once somebody has been diagnosed with an ACL tear, usually this happens from some type of sporting activity, but it's not always a sporting activity. Somebody can just be walking and twist wrong and tear their ACL. A lot of people will tear their ACL in what we call a non-contact injury, where they'll just be running and try to pivot and the knee will give out on them. Now, occasionally we will see patients like football players or basketball players who've been struck from the outside part of the knee and their knee will buckle and they'll also sustain an ACL tear. Once somebody comes into the office and I suspect that they have an ACL tear, we'll have to get an MRI, which is a special test to look inside the knee at the ligaments, and that will confirm the diagnosis. Most patients who have an ACL or anterior cruciate ligament tear are going to require surgery to fix that ligament because it does not heal on its own. Because it provides the main stability to the knee, especially in younger patients who want to remain active, I would encourage them to have it reconstructed, because that will provide their knee good stability and allow them to go back to playing sports or running or participating in any type of athletic type activity. The surgery itself is a reconstruction and not a repair, and the reason that is because over the number of years we've shown that trying to fix the ligament and repair it back does not work, and so what we actually have to do is make a new ligament. And there are a couple of different options to make the new ligament. Two of the main options are the hamstring tendon that we take from the person's own knee, or the patellar tendon that we take from the person's own knee. Those are the two most common graft choices. The other graft choice that is more common in folks who are 40 years around age or older is a cadaver graft, and there are many types of cadaver grafts, but I generally will only encourage patients who are 40 or older to use that graft option. Once we take you to surgery, then we use one of those graft options to basically reconstruct the ligament. It takes a long period of time for that ligament to turn into a new ACL, and so that's why it takes a long period of time to rehabilitate and get back to sports. Generally, it takes about anywhere from 8 to 12 months before someone's rehabbed and healed enough to go back to play any type of competitive sports. Now, in the meantime, they're up and moving around. They have a brace on their knee for about 6 weeks. They might be on crutches for just a couple of weeks, and then they have to undergo an extensive rehabilitation period to get the strength back in their knee and to also allow that ligament to heal. And then generally after about 8 months, if the knee is strong enough, we'll allow them to return to sports.
For more information, visit us online at conwaymedicalcenter.com.